So I will ask more specifically what the situation of young people is today in post-apartheid South Africa, and what kind of policies are in place, or what the gaps are in that policy environment for young people. So we know that post-apartheid South Africa has put in place an array of policies and interventions that are meant to undo the inequalities and the poverty in the past, and we can think of that as a package of support policies that is meant to redistribute wealth and but also opportunities and income. And so we can think of, or at least South Africa calls this a social wage package, and we can think of that as in part running across the life course, including access to public health care, access to public schools, including no-fee schools for the poorest children, the building of RDP houses, and the expansion of the delivery of basic services. Alongside of that, there are more targeted interventions such as the child support grant, which has been extended to run across the life course from when the child is born up until the age of 18, or if that child is in foster care, up until the age of 22. And at later ages, there is the old age pension, targeted at people who are no longer expected by society to be taking part actively in the labour market. And then, as Patrizio pointed out earlier on as well, there are other packages of support that have been developed over the last couple of years, and a strong focus worldwide, but also in South Africa, has been on early childhood development, based on a strong body of evidence internationally that shows that investment in those earliest years of children has a longer term positive effect later on. But the question is then, if these are the packages that are in place, what happens to the children that have accessed early childhood development when they become adolescents and young adults later on in life? And I think the evidence on that is still coming in South Africa. But B, also what happens at this stage here, where society largely assumes that young people from the age of 18 onwards quite swiftly move through the education system, either into the higher education system or into the labor market, and therefore become active participants of the labor market and earn an income. We know that in South Africa that is for very many young people not the case, and I will come back to the figures just now. And so what we see is that at really crucial times in the development of a child, as they become adolescents and then young adults, that kind of comprehensive approach to support doesn't exist. And so the question is, what happens here when young people literally begin to fall through the cracks? And it's not as if no support exists for no young people. So for some young people, those who access, for example, higher education, there is now the NSFAS grant, but in general, the same kind of comprehensive approach that exists towards all small children does not exist for all young people. And yet there is also an international literature that says these stages of adolescence and young adulthood are equally crucial. And in fact, behaviors that appear in adolescence solidify for what happens later on in life. So the question then is, what can we as researchers contribute to the beginning to think through a more comprehensive approach to support across the life course, and in particular focusing on adolescence and young adulthood? What we asked ourselves when we started thinking about that question was, well, these packages, these interventions that exist in the post-apartheid South African context, what changes have they brought about in the lives of young people? And so we heard Patrizio and Murray speak about intergenerational transmission of poverty, and this isn't the same kind of nuanced analysis as the one that Patrizio was talking about, but what we did was we took the cohort of young people in the 1996 census, those between the ages of 15 to 24, and looked at some of these key indicators that if these interventions and policies that have been put in place have been making a difference, we should be seeing a change in some of these key indicators. So we compared the cohort of young people in the 1996 census with those who were young in the 2011 census. And what we see is that in some areas things have improved. So fewer young people are living in informal and traditional dwellings. Fewer young people live without piped water on site. Fewer young people do not have a matric. In other words, more young people are completing higher levels of education. But in fact, unemployment rates and income poverty remain very similar. And these are, so remember this is 2011 census data, so if we were to look at other data sources, in fact the unemployment rate for young people would be higher than what it is now. And income poverty, we had a question about that earlier. In this particular graph is defined as youth living in households with a per capita monthly income below the StatsSA upper bound poverty line for 2011, which was 620 Rand. So in other words, close to 60% of young people continue to live in income poverty today. And well, in 2011, but things haven't changed much. What Murray spoke about, and others, I can't remember who spoke about what anymore, is of course that deprivation consists of more than just income poverty. And what is important to remember is that these different dimensions of deprivation play out at the same time in people's lives, so in a young person's life. A young person isn't only living in an income poor household, but may also be living in inadequate housing, have access to low quality education, limited access to information, connectivity, all the things that we spoke about earlier happen simultaneously in the life of a young person. So our question then as researchers was, okay, well, so how can we, what can we do? Keeping all of that in mind based on the literature and the data that we have, what is it that we can bring to the policy sphere and the thinking around interventions that could begin to make a bit of a change? And this isn't an easy area to engage in as researchers because the policy sphere traditionally is very different from the research sphere. But so we've worked quite hard at building collaborations with policymakers from different departments and with institutes such as Statistics South Africa to think about what it is that would be needed to inform policy and intervention. And so one of the things we've been working on is the creation of a dashboard of indicators on youth well-being and a multidimensional poverty index. And alongside of that, we have thought quite hard about how we can begin to bring that information in an accessible way to policymakers and practitioners. And so what I will show you just now is an interactive platform, website, where we bring together the information on a range of indicators of youth well-being in one particular place. But we also, thinking through the levels of inequality in our country, do so down to the small area level. So we can look at the proportion of young people that are unemployed in the country or the proportion of young people that are passing matric in the country, but the national average, of course, hides very severe levels of inequality. And so what we wanted to do was to make sure that the information was available down to the sub-provincial level. So we have a dashboard of indicators, and I will just try to take you there. And I would like to invite all of you to go and look at it. It's called youthexplorer.org.za. We can browse South Africa if our internet connection allows us. And up here we have the various domains of indicators under which we've brought together information. So we have basic demographics, we have levels of education, economic opportunities, family and living environment, poverty and health and wellness. We have this for the entire country, and like I said, for some indicators we have this down to the ward level, for others we only have it down to the municipal level. And we work with two data sources. One is the Census 2011 and the other one is the Community Survey 2016, because we wanted to start to explore what trends are going on. The problem with the Community Survey is that it is not representative down to the ward level but only to the municipal level, and that not all data have been released. So we don't have information on income and employment. So we didn't only think about income poverty and these various domains of well-being. So there is also, for example, an indicator that tells us about what proportion of young people is living with employed adults in the household. Because we heard earlier on that one of the barriers against young people easily finding employment is lack of access to information and having people who are employed in their environment. So we also have that as an indicator on the portal. But we wanted to think not only through indicators like that separately, but as I said, combined in a youth multidimensional poverty index. Murray showed us earlier the slide of the SAMPI, the South African Multidimensional Poverty Index, that was created by StatsSA. We followed a very similar approach, but slightly different, because we wanted to use domains and indicators that were very specific to the situation of young people, and we wanted to make sure that we use domains that are that can be influenced by public policy or by interventions on the ground. And so we combined 4 domains. One is education, health, standard of living, and economic opportunities. And within each of these, we then defined a number of indicators that we would combine, and on the basis of which we designed deprivation cutoffs. So in other words, for example, in education, a young person would be considered deprived in educational attainment if he or she, by the age of, I need to have another look, by the age of 15 to 16, has completed less than primary school. So we would assume a 16-year-old to have completed primary education. If that is not the case, that person would be considered deprived in educational attainment. If by the age of 17 to 20, they have not completed grade 9, and so on. So there are a range of deprivation cutoffs that then get applied to each of these indicators. They get weighted, each of the dimensions get weighted, and we ran a number of tests to make sure that the weights we were applying were accurate as they can be, and we tried to see whether if we changed any of the weights, any of the results would change. So what does it look like? So we have in South Africa, when we define young people as multidimensionally poor, 33.4% of our youth population would be considered multidimensionally poor. That's at the national level. In other words, that's more than 3 million young people in the country for whom more than one kind of deprivation plays out at the same time. Again, what we see is substantial differences in the poverty headcounts across the country and within the provinces. So when we map this down to the municipal level for the country, we see that multidimensional deprivation remains mainly concentrated in the former homelands, but when we disaggregate, and I could go back to the portal, but I won't in view of the time, when we again go and look at a province like the Western Cape, where the overall multidimensional proportion of young people who are multidimensionally poor is not as high, we see severe pockets of deprivation happening. Again, what is interesting is that we can unpack which dimension of deprivation is driving multidimensional poverty. So among those young people who are considered multidimensionally poor, when we look at the decomposition of the index, we see that educational attainment is the main driver of deprivation. Following closely to that is access to sanitation, but also unemployment, and it's a little bit misleading. I went and double checked. In fact, that is not the unemployment status of the young person, him or herself, but living in a household where someone else is employed, is another key driver of deprivation among multidimensionally poor youth. Why this is important is because this tells us, A, what is the driver behind, what is the largest contributor to deprivation among those who are more severely deprived, but also because this composition as well, itself also differs between provinces and municipalities. So in a province as the Western Cape, we see very clearly that educational attainment and being neat, not in any kind of education, employment, or training, are the largest contributors to multidimensional poverty, but not so, for example, in the Eastern Cape, where living environments have a higher proportion of multidimensionally poor youth. I'm going to leave it at that.